let's talk about the skull, which consists of the cranium and the facial skeleton, and of course a cap-like structure called as cranial vault. Now see, the skull has to protect your brain by enclosing inside. Now you can see there are the bony sockets that holds your eyeballs, and definitely nose is there to inspire. Now what else? It encloses the inner ear in your temporal bones. Now what else it has to do? It gives attachment to various facial expressive muscles, and of course teeth to chew the food. So your skull has to deal with so many functions. Now this view, the Norma Frontalis interior view, is showing various bones that take part in your skull formation. In the green color bone, which is the frontal bone, that is unpaired, and just posterior to it we have got another bone called as occipital bone, and in the very center there are two other unpaired bone called as ethmoid and sphenoid. But if we talk about the paired bone, concentrate on the lateral aspect, you find the parietal bones and the temporal bones on each side. And if you concentrate that in the ear, there lies three ear ossicles called as malleus, incus and stapes. They are also paired. And if you concentrate on the bones of the facial skeleton, see the maxilla that later on fused, and then you see the mandible bone, and you find the nasal bone, lacrimal bone, the palatine bone and the inferior nasal concha on both sides. And also you can add the vomer bone. These are the bones of the facial skeleton and the skull, right? Now see individually that the frontal bone is forming the forehead and also taking part in the formation of the orbit. Now see the nasal bone. These are two in number and they are forming a suture called internasal suture, right? Now concentrate on the maxilla bone that is marked with the purple color, right? Now see the cheekbones called as zygomatic bones. They are also contributing to form your cheekbones, the zygomatic arch, and also contributing in the walls of the orbit. Now see the bilateral presence of parietal bones. Also give a look to the sphenoid bone. You can see its greater wing and the body and the lesser wing, right? Now concentrate the temporal bone, which is again bilaterally present, right? Now have a look on the mandible, which is showing its body, its rami and the angles where the arrow is marked. Now here in this picture we have to focus on various sinuses, especially the frontal air sinuses you can visualize. And then behind the maxilla or inside it you find the maxillary sinus and the deep-seated, the ethmoidal sinuses. And if we are supposed to see the lateral aspect of inner side, we can have the sphenoidal air sinuses, right? Now we have to look towards the various sutures. Concentrate on the coronal suture that starts from the one temporal area towards the other temporal area or fossa. You can see it resembles with that of a crown. You can see the crown wearing lady on the left side, right? Then we have to learn about the sagittal suture that is present in between the two parietal bones. They articulate via sagittal suture that is present on the vertex of the skull, right? Then concentrate on the lambdoid suture that is like an inverted V-shaped letter that is present in between the occipital bone posteriorly and the two parietal bone, right? Now concentrate on the Norma Frontalis that there lies the frontal bone. It contributes in the formation of the roof of your orbit as well. And what else you can see? That there lies the two superciliary arches and the median projection or elevated area called as glabella. and you can see that the two nasal bones are going to articulate with each other at internasal suture, and it is also forming a suture with the frontal bone called as frontonasal suture. You see here, you can find that there lies the nasal aperture, which is being separated by the nasal septum, and anteriorly you find the internasal spine, and also there lies the vertically arranged bone called as vomer bone. Now concentrate and there are bones in the nose called as inferior nasal concha. They are present on both sides of the nasal cavity. What else you see in the Norma Frontalis? That there lies the maxilla that also takes part in the formation, especially of the floor of your orbit, and they are also making the alveolar arches. What else you see here? You find the zygomatic bones. The cheekbones are present bilaterally. What else you see? There lies the parietal and the temporal bones on the lateral aspect of the skull. Now concentrate that there is a mandible that provides again the alveolar sockets, and also it is gonna form the temporomandibular joint through its condylar process. Now find the supraorbital fissure, and the purple color is the infraorbital fissure, right? Now in this picture there is another important structure called as nasolacrimal duct. You can find the lacrimal gland present on the lateral aspect of the orbit, and from here the fluid or lacrimal fluid is coming downwards via nasolacrimal duct and going to open into your nasal cavity. Look into the bone where there is a location of the passage of the nasolacrimal duct through nasolacrimal canal. Now this is the picture of the skull to show the infraorbital fissure, right? Now in this diagram of the skull, we can visualize the supraorbital fissure or supraorbital foramen at the junction of the medial 1/3 and the lateral 2/3 of the superior orbital margin, and you can visualize near the infraorbital margin there lies the infraorbital foramen, and on the mandible you get the mental foramen. What structures are supposed to pass through it? Concentrate on the figure of the left side. There is the trigeminal nerve that divides into three divisions: the ophthalmic and the maxillary and the mandibular. They are supposed to pass through these respected foramen, giving rise to branches of the same name like supraorbital nerve, the infraorbital nerve, and the mental nerve. Now this is the picture again to show you the vomer bone vertically lying and the inferior nasal concha present on both sides, and you can see the nasal bones forming the roof of your nose, and you can concentrate on the mandible as well. Now this is the sagittal cut section, and the green color is the vomer bone. Now you can see how it is present just below the nasal septum and is being attached postero-inferiorly with that of the palatine bone and anterosuperiorly with the ethmoid bone. Now in this picture, the ethmoid bone in a mauve color is highlighted because it is a deep-seated form, be a bone located to form the cribriform plate of ethmoid as well, and also takes part in the medial wall of your orbit. And this is the map to show you various bones that take part in the orbit. There lies the frontal, lacrimal, sphenoid, zygomatic, maxillary, and the palatine, right? Now in this picture you can see the inferior nasal concha present bilaterally. What it has to do? It increases the surface area of your nose and keep the air warm before it enters into your lungs, right? Now in this picture we have marked supraorbital foramen or notch, and you can see infraorbital foramen and the mental foramen. Let me repeat, they are supposed to allow the passage of supraorbital nerve from the supraorbital foramen, which is a branch of ophthalmic division of the fifth cranial nerve. Now concentrate on the infraorbital nerve that has to pass through the foramen of the same name, again a branch of maxillary division of the trigeminal nerve. Now concentrate that the mental nerve is supposed to pass through mental foramen, which is a branch of mandibular division of the trigeminal nerve, right?